Closed? Open? When's the last time you saw a dentist?
Within the last 6 months.
I thought you worked for a dentist.
I was,
Every day.
Just see you
As
in
a
the hall.
patient.
Is everything okay?
Yeah.
Good, there's my dental exam. Told you that was my dental exam. Okay, so this is the myTAP. The nice thing with the myTAP is that little knob that I took off, I call that the volume control knob. So the nice thing with this appliance is literally the patient's bed partner can roll over in the middle of the night and go, and change his jaw position, which is pretty cool. So that's why the dude, Keith Thornton, that invented this, he invented it for that reason, that sleep technicians would fit these and then adjust them live in the sleep lounge. Okay, that never took off, but that's why it was invented that way. So this is this thermacryl, it's a white thermacryl. I'm gonna put it in the boiling water and it's gonna turn clear really quick. There's a new temporary out by the EMA company that I'm actually currently wearing just to check it out. I do every appliance you've seen I've worn, like I told you, I just like try these all on myself. And I really like it. The temporary myTAP EMA is nice, and it's the same type of thing where I am in control of the position because they can only move their jaw where I give them bands. The disadvantage of the myTAP, as you're going to see in a second, not only can their bed partner adjust it, but anyone else can adjust it. So they can jack their jaw a mile forward. So we get it clear like this, open for me, and then I'm going to sneak it in his mouth, get it on the midline, okay, and then close for me. Get your lips around that. Okay, now suck in with your cheeks and push out with your tongue. You don't have to kill yourself, but just in and out with your tongue. So what I'm doing there is he's pushing it into his embrasures. You can try to go in with your finger, it's terrible. So if you're gonna go in with your finger, you gotta like lube it up with Vaseline and stuff like that. This is actually more effective, as you'll see in a second. So I'm just having him squeeze in with his cheeks, push out with his tongue, and then we'll let that get to closer to this white color. The ice water is to snap set it, and that's how we're gonna get our retention. So I'm gonna take it out, dip it in the ice water, and then it's gonna be quite retentive. Okay, so as this is setting up, let me see, like this, okay. As this is setting up, why might we want a temporary device? What are some of the reasons? You guys can just kind of ask me.
See if they're compatible.
See if they're compatible, like see if they like it.
Right.
Yeah. Now the only disadvantage of that is just remember that this will be different than their custom appliance. So make them aware of that. Hey, we're just going to try this. This is different. This is kind of like flip-flops. If I give you a custom appliance, it's like army boots. So just be prepared. You're going to need a little bit of time to get used to it. Blah blah blah. Okay. Another concern with this is he may like this better, and he's like, oh, I'll just keep this one. You can keep your $2,000 one. Okay, so I wouldn't do that. I would make this part of the bigger package. Hey, I'm going to fit you today, because it's going to take us a month to get your ProSomnus in. I'm going to fit you today. Now, actually, with ProSomnus, I'm glad I said that out loud, as I wouldn't have normally taught this. We used to do this method in the Army. So the myTAP to the ProSomnus, we stopped. Why we stopped is because this is a active device, which means it's going to move his teeth. If I scanned him and then I have a precision-made appliance like the ProSomnus, what could be the problem? It won't fit, okay? Now the Evo, probably you'd be fine, but the traditional original ProSomnus is so stiff that we were having problems, so we stopped doing the myTAP for those people. Okay, it's just a little opaque, that's what I'm going for. I'm gonna wiggle it out. Wiggle, 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 wiggle. Okay, nice, you did a great job. See all in the embrasures there, beautiful. And I never put my hands in his mouth. Ice water. If he had a lower retainer, you don't have a lower retainer, do you? Then I might worry about that slightly. Okay, that's it. Go and pop that in yourself.
you might worry about the lower retainer.
Just I would
if
just take
they
it off
stick
now.
to it. Okay.
Yeah. Got it? Cool. Can you take that out without using your hands?
No.
Okay, cool.
So
Go ahead
it's
and
a
pop it
detail.
out with your fingers. Pretty good retention. Okay, so there's my retention. Let's do the work. Now, one of the main reasons we use temporary appliances in my office is not for why you would think. So the main reason we use temporary appliances in my office is because they break their appliance, or their
Oh.
dog eats their appliance.
Mm-hmm.
Okay, dog eat the appliance, very common.
Oh, yeah.
Like it's in our informed consent in bold
Yeah.
caps.
I always.
Like
talk
if you have a
to
dog,
Yeah.
keep this the freak away from your dog. If they have a dog and a cat, they'll work in tandem.
Oh.
Knocks it on the ground and
Yeah.
the dog eats it. It's crazy, right?
That's a good at knocking.
So that's the main reason, because if you have a patient and they come in and like, oh shoot, I broke my appliance, or my dog ate my appliance, and you're like, oh, no problem, we'll just get you a new one. It'll be 3 to 4 weeks. Okay? Think about that for a second. So if you had a pillow that you used every night and someone's like, oh yeah, I'll just take that away from you for 3 or 4 weeks. Except it's way worse. They don't have treatment. Technically, you're supposed to tell them to go back on CPAP during that time. Okay? Because they're not treating their disease. Okay, let's do 5. So the hardest part of this is sneaking it in and not having it bend onto his teeth, which I've done a fairly good job, it looks like. All right, good, close down. I'm kind of using this to be on his midline, same thing, suck in, push out.
When you say bend on his teeth, you're trying to make
So
sure it doesn't.
it's soft,
Oh,
right?
oh, that it
So
doesn't
one of the
fold.
advantages of the EMA,
Yeah.
which I've got over here. So the EMA now is this one. You kind of pass that around.
Yeah.
But you'll see it's in a tray. So
Yeah.
that tray gives rigidity to it.
Yeah.
And so it's less likely to fold in on the teeth.
Ah, got it.
But you
Yeah.
still mold it like that?
You mold it exactly the same way.
I
Yeah, so
see.
the EMA now is the same. The advantage of the EMA now is the bands. And that's also the disadvantage of the EMA now. So can you see how like almost every one of these appliances, I can give you pros and cons. So if I want to be in control, like I've got a patient, I don't know, they might be flaky. By the way, so this is a rarity that I'm doing with Justin right now. Do I have records on him?
No.
No. So I don't have his bike registration, I don't have x-rays, I got nothing. So he goes off, he disappears,
And
comes back 3 years from now with his jaw out to here.
Yeah.
I'm screwed. I have no records. Now Justin's not gonna do that to me. No one ever has at any of these courses I do. But you should never treat a patient with a temporary device without full records.
Oh, sure.
Full records. Yeah, why don't you go ahead and give the 3-digit code over
I have
there.
it 11 o'clock.
You just ask him to bite it normal, MIT.
Hi. So for this morning, the 3-digit code is 241.
241.
241.
Thank you.
Hey, thanks for coming.
Thank you.
for having me.
241. Remember to download the slides and all that kind of stuff, and
When do you give your
Oh,
2-hour?
by the way-
When do you give that 2-hour lecture again?
at CDA, Anaheim. But go to glidewelldental.com, there's a bunch of free stuff.
Okay.
But do me a favor, give me, if you want, give me your email address, because I'm gonna send
Anybody
everyone
need to
here
see this?
some additional information.
Anybody else? I'll put it back.
So before you guys leave, I'm just gonna pass around a piece of paper, give me your business card or something if you want, and I'm gonna send out some additional information for you guys. Okay, go ahead and pop that one in.
So Dr. Spencer, you just did MIP, right? Nothing.
So I'm just having him close down.
Whatever.
So
However he closes.
you asked a minute ago, where do we determine how to start people? Okay, comfortably protruded was the George gauge.
Yeah.
That fits good. Pop it out. Now, by the way, when you get home, if this is a little too tight somewhere,
This one's not
whatever,
as retentive.
you can just go a little bit of hot water. What's that?
This one's not as retentive as
Not
the
as
other.
retentive, and it looks like we kind of bent it in there on the premolars a little bit, but I think it's still gonna be fine. So let's try it. So I'll show you too, how we determine the initial position with an appliance. Okay, go ahead and pop that in.
241.
Yes. Make sure you put your name and information. Thank you.
Thank you.
Give me room.
As long as you make sure you scan out though. Don't forget that.
Well, it scan me out because it wouldn't scan me in.
Just check it.
Got it? Just bite down. Yep, yawn, open. Okay, so it's staying on your teeth pretty good. All right, so now, just kind of lean back a little bit. This isn't ideal. So a dental chair, I would just lean him back in the dental chair. That's nice. And here's what I'm going for, is I want you to feel that it's keeping your jaw from falling backwards. Okay, so when I start a patient with an oral appliance, there's 3 positions, so to speak. It's doing nothing at all, it's jacking your jaw way forward, or it's keeping your jaw from falling backwards. The initial position is it's keeping my jaw from falling backwards. Does that make sense? So it's doing nothing, It's jacking my jaw way forward, don't want that. It feels like it's keeping my jaw from falling backwards. Okay, so right now, is it doing nothing? So let me take it to nothing. Okay, you should relax your jaw, and it should feel like it's doing nothing at all, right? Okay, so now you tell me when it feels like it's engaged. It's actually holding your jaw. Right there?
Yeah.
And that's it. Okay? So that's where I would start. Okay, then, if he's has a bed partner, I might say, hey, you know, first couple days, 2 or 3 days, just get used to wearing it, wear it through the night, but then eventually they can roll over and crank, 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 crank. And I don't care how fast they crank it. It's all about opening the airway. Okay? Now here's something else that we can do. So you want to pop that out for me, Justin? And I like having the patient pop it out and put it in themselves because it gets them used to like how do I use it and stuff like that. Okay? Make a snoring noise in the back of your throat. Not your nose, but your back of your throat. Okay, good. Pop this in. Good. Make the noise. Can't.
Wow.
Okay, now that doesn't always work. But sometimes it does. And when it does, it's awesome. Because then he's like, I can't. And right there, they'll be like, oh my gosh, it's going to work. So we'll do that with the George gauge too. Back, forward, blah, blah, comfortably protruded, take the bite, and we'll say, hey, just real quick, go ahead and make a snoring noise. Okay, do it with this end. I can't. Nice. But if they go, you're like, okay, come on. Just ignore it.
How long is this good for?
The myTAP, so technically 30 days, but he could wear this for years.
Oh.
So again, all temporary appliances is actually my fault because I was the first one through the FDA with them, are 30 days. But they all last way longer than 30 days. In your case too, you saw the sushi appliance. That's the silent sleep, which is my appliance I developed. Really the main use for that appliance is over aligners. So if you want to treat someone for aligners and sleep apnea or snoring at the same time, you fit that over their aligners. You don't have to change it.
Right, because it just still fits over there. How retentive is it with
Great.
liners? Oh.
Great. Yeah, just right over the aligners.
Okay.
Is that feeling okay? Okay, pop it out.
What is that called?
Silent sleep.
Yeah, this is
Yeah, you'd have to email me on it because our website, like, I don't do a good job of selling that.
So that's
By the way, this only goes in the case like this.
the pink stuff.
It's just frustrating because it's not like that, you would think. So it's only to the corner. And that's it. So this appliance, great if, again, if Justin's like, oh yeah, my bed partner says I'm snoring like crazy, and we can get that feedback and they're gonna turn it and kind of measure it, it comes back, and now I've got the position. So you could use that for, I want to know I'm going to the right position. Okay, or I just want to prove it that it's gonna work. Or I have a patient that they just broke their appliance. Or I'm a dentist, so actually, frankly, the majority of my taps that I fit, other than courses, are for dentists.
Yeah.
Because, you know, you show up at my course, you're falling asleep at 10 o'clock on day one. I'm like, dude, what's wrong with you? Oh, I forgot my appliance. Oh, I didn't bring my CPAP. I'm sleeping like crap. I make him an appliance the next day, he's all good. Okay?
So,